Great, good morning. Audrey, you want to put
Yep.
up the slides and we can just kick off here?
Yep.
Well, first of all, thank you all for coming. There's a lot of energy behind Project Pivot. It's exciting to see um, the energy and, we come together, in this webinar and actually in this project, the spirit of community, in the spirit of wanting to see this succeed. We're all teachers and learners, so we welcome constructive input. And so we'll just kick this off. This is Project Pivot. We're not going to go too deep into what is, the whole background of Project Pivot. A lot of you know it. But for those of you, I know a lot of people are new to this concept of patient-reported measures and patient-reported experience, patient-reported outcomes. And basically, as we're diving into Project Pivot, I just want to just to simplify that patient-reported measures, they basically just capture information from patients via surveys. So they ask patients about our experience, about how we end up, our outcomes. So really what we're talking about in Project Pivot are these surveys that have questions on them. And we have the opportunity to help inform, what are those questions on surveys? Surveys that are used, that hospitals use, that our government use, that researchers use. So actually, when we're talking about patient-reported measures, it's actually our opportunity to create questions that matter to us about safety, discrimination, and diagnoses. Next slide. So we want to thank our funders, Gordon Betty Moore Foundation, the John A. Hartford Foundation, the Jewish Healthcare Foundation, as well as PCORI have all contributed to making this a reality. Thanks to all of them. Next slide. So I also want to welcome all of our national and international guests. If you could put in the chat your name, your organization, and your country. We know we have collaborators overseas. Again, we can learn from each other. I know a lot of people overseas, Saudi Arabia, Italy, India, the United Kingdom have used patient-reported experience measures and outcomes in the work that they do around safety and quality. So welcome to everybody. Let's get to know each other in the chat. Again, sorry that we can't take time to get to know everybody. But this community building is going to be, I think, a core, it's going to be so valuable to have everybody's input in making this project succeed, including those from overseas. Go to the next slide, please. So we're going to talk about here's our objectives. We're going to talk about Pivot. We're going to review a timeline of activity, just so you know what's coming down the pipeline. We're going to share some recent updates and next steps. We're gonna show everybody that, the names of the organizations and people involved in Project Pivot. We're going to talk about what does it mean to be part of Pivot and how to collaborate. One of the main parts of today is to brainstorm ideas for a social media awareness campaign where we're going to reach out to the social media public and ask for input from them. And then we're going to share how you can get involved, and we're going to announce World Patient Safety Day events 2024. Next slide, please. So this is the new picture about Patient Pivot. This kind of tells you the story of what we're going to do over the course of a year plus a few months. As you know, Pivot hasn't launched yet, but there's so much enthusiasm and input that we're getting ideas from people that we thought it was important to start now. So over the year, what we're going to do, as you can see on the far left, we're going to start building community, and you are the beginning of this community. And what we want to do from the very beginning, and you're going to hear more about the social media campaign, but we want to do a variety of things to learn from the patient community. We want to start building this patient community, learning from patients about what matters most to them about their experience in safety, discrimination, and bias, and their diagnostic journey. And we're going to do that, through a variety of mechanisms, mostly through social media. We'll do some of that in our in-person meeting in September 15th and 16th. And I want to highlight that this project is for, it is capturing concepts and ideas from all patients, especially those with lived experience. But this project has a special focus on older adults, people with disabilities, and mothers who experience disparities in their birthing experience. Really important populations. So if you see, we're going to start learning about what matters most to them. And then we're going to go into phase 2, where we've already actually started phase 2, where we're inviting input from everybody that wants to be involved in giving input on existing patient-reported experience and patient-reported outcomes. So existing questions on questionnaires. So we've received some here in the United States. We've received some from Saudi Arabia, India, I believe, and other countries. So what we're doing is we're going to package all these like already existing questions that are out there in questionnaires. But we're also going to be collecting what questions don't exist. And you can see that from this graphic. We're going to be collecting from patients, and consumer organizations, healthcare system leaders. You'll see our healthcare system leaders later on. Professional societies, we have professional societies, they're now part of Pivot, researchers, and as well as industry, because we think that everybody can contribute questions that might matter to them. But as you see in phase 3, the organize and prioritize, then we'll go through the prioritization process with patients and patient consumer organizations and communities to ensure that what comes out of this process are questionnaire items or pre's and pros that matter most to patients, families, and communities. So we're going to welcome, all input into this funnel. You can see that, who are part of Project Pivot, because we think everybody might have good ideas, and we're already getting good ideas about new questions, potential questions for questionnaires such as HCAHPS and patient-reported outcome measures, and outside the patient community. And so we see that there's value in opening up this sending out a big net to capture questions, and then the patients will prioritize them. Then we'll publicize and mobilize, and we will disseminate and distribute to all the players that you see on the bottom there, and all the players in the bottom are already part of Pivot. So we want them included, we want them to also include in the funnel. And Armando, I don't know if you've already done so, but we have a form on our website, and Armando will give you the link, where if you know of existing questionnaire items that are important. For example, we got a questionnaire item, it was one question, but it was from CDC, and it was an important question. And we got one question from Professional Society. If you have questions that you think would be really valuable to be on measurement tools such as HCAHPS and patient-reported outcome measure tools, go to our website and go down to the bottom of the Pivot page, and you can enter in what are your questions. And as we gather these questions, now this is an idea we have, we want to inform you what we're getting back. So we may create like an ongoing, either a Wordle or some type of feedback, so you can see what's coming in. And we want to start doing that. We feel that one of our principles and beliefs is transparency. So we want to share with you along the way as this progresses what we're learning from everybody, quite frankly. Go to the next slide, please. So this is going to be a timeline, just so you have an idea. I mean, this is subject to change, but you can see that phase 1, we're in phase 1, where we are building community. We are, launching a social media campaign that Lee Frost and I will talk about a little later on. On July 24th, we're going to have a capacity building webinar. I mean, patient-reported experience and patient-reported outcome measures are relatively new, definitely to the patient community, but also even to clinicians and others when these are used as measures. So we're going to have, what our patient-reported measure, kind of learn more about it for those who want to really get engaged. In August, we're going to launch an appreciative inquiry exercise. Again, we really feel like building community is going to be important. We haven't fine-tuned those questions. They'll be easy questions, but questions like, what does success look like in Project Pivot to you and your community? How do we measure success? We're going to build some positive questions so that we will share all of them when we come together in September. Then our kickoff, in-person kickoff meeting is in Washington, D.C. We're going to talk a little more about that September 15th and 16th. So we're building community phase 1. Phase 2, identify. We're already in phase 2, really. It started by people sending in questions, patient-reported outcome, patient-reported experience measures into to our portal on our website. So we're already collecting patient-reported experience and patient-reported outcome survey questions from all over the world. And then, we are opening our portal that will collect and review proposed new questions submitted by patients and other stakeholders. We're already getting some of those as well. Phase 3 will be, oh my goodness, I have the wrong, I have the in-person prioritization. Oh yes, we're good. Phase 3 will be, this is when we start organizing and prioritizing. We're going to have a series of virtual sessions, small group virtual sessions. We're going to create and disseminate with all of you surveys for patients, for healthcare partners, for other groups that agree to survey their communities, such as healthcare systems. I don't know if Divvy's on with Geisinger Health, but he's going to survey, healthcare leaders within his hospital about what matters most to healthcare leaders. Where ASAP has just joined us. We hope that we can learn from emergency department clinicians and infection control professionals. So we hope to do this. We're calling it a survey. It might be done online. Some groups might want to use other engagement methods such as focus groups. We might create surveys that we put on social media with a QR code. So we're really trying to think creatively how we reach a broad audience. From that, then we'll start, going from here to here, identifying what are the most important survey questions or the PRO, PRE questions that are beginning to bubble up to the top. And then we're also going to be identifying what are the most important PRE and PRO questions that don't exist. So we're going to be seeing, we're going to be prioritizing the questions that already exist. And we're going to be prioritizing those that we get that people want to be innovative and creative, say, this doesn't exist, but I'd like to see this in a survey. Then we'll have the in-person prioritization meeting. Right now, it's scheduled for June of 2025. We're hoping to extend that into September so we can again do it on World Patient Safety Day. And then at the end of the project in 2025 and beyond, we're going to have a final report. We're going to disseminate, hopefully partner with developers to create new measures, partner with implementers to consider what steps they need to take to adapt existing questions and tools. So that is a high level, like what's going to happen over the next year and basically the next year. So we can go to the next session, and I'm going to ask, you might have questions, and when we get through these, we hope to have plenty of time for Q&A. Next slide, please. Okay, Suze, I think you're going to take over now. Sue Schrant.
Yep, great. Hi, everyone. Sue Schrant. I'm one of the co-leads of the project. It's great to be with all of you. I'm just going to share a little bit about who's sort of raised their hand to partner so far. I'm not going to read you all of these names. I'll kind of explain each of these slides just in terms of the intention behind who is involved. You see at the bottom of the slide a shout out to the priority populations for our work. And this is very intentional. We wanted to have a particular focus on people with disabilities, older adults, and mothers who experience disparity in their maternal care experience. Because what we know about collecting this information from patients and communities is these are populations who are disparately affected by unsafe care. We want to make sure that we're sort of over-representing and really capturing from that entire universe of people. But we really want to hear from everybody. So what you see reflected here is specific disease-focused organizations, more community-based organizations, organizations that represent particular types of people like AARP, people who are uh, uh, in older decades of life. Everyone's got unique challenges and issues in their care pathways. And so we really need to hear from a wide diversity of people. And it's important to note that you see both organizations listed, and then you see the very last bullet point is individual patient champions. There is not a bar to participate just because you're not affiliated with a larger group. So this is truly a big tent. We want everyone involved. That means there's going to be a lot of work to coordinate and synthesize and prioritize. But that's what makes this so rich, is hearing directly from all of these groups. And so if you don't see your name here and you want it here, let us know. This is growing by leaps and bounds. It's hard to keep our slides up to date. So let's go to the next slide. And our healthcare systems and professional societies. And again, this is also continuing to grow. Sue kind of spoke to this, but if we really want this to be about true partnership and coming together and sharing our relative expertise, then that means we need everyone involved. Patients and community members will play a really key role. And you saw in Sue's slide where there's sort of that prioritization phase. We really need to make sure that what patients and communities prioritize as most important to learn and capture, that we never lose that. It's just that we're going to blend it and coordinate it and sort of braid it with what we learn from these amazing research and healthcare and professional society partners. Again, if you don't see your name here and you want it here, please reach out. This continues to grow as well. So we can go to the next slide. We also have what we're calling implementation collaborators. The language we're using is all it's very much on purpose. None of this language is by accident. You saw in sort of the timeline of the project that it doesn't end. It's a summer 2025 and beyond. And so we're thinking with the end in mind. We don't want to do all this work, involve all of you in doing all this work, and then have it sit in a peer-reviewed article on a shelf. We want this to be real. We want it to be useful, and we want uptake and having these items embedded across numerous locations and in different parts of the healthcare ecosystem. And so these implementation collaborators, by being involved up front, we can sort of be thinking about what do we need to do? How do we set this up for success so that when we get all the way to the downstream effects of this project, we've got those partners ready to implement. And so this is a really important kind of construct for this project. We can go to the next slide. And we, of course, have our community of international collaborators. There's so much going on in this space, hearing directly from patients and families and communities about what they need and want in safe, equitable care. And so we can learn so much by involving these international collaborators. And so we welcome everyone to the table. And you can be involved kind of however that makes sense for you as an individual or an organization. So if we go to the next slide, I can actually talk a little bit more about kind of what it means. What does it mean to be a partner or collaborator? I know all of us on the project team have been having these conversations. The kind of challenge and opportunity with a project like this, where we truly want to build it as a community, is that we don't want to say exactly what the specifications are, exactly what every detail is, because that necessarily needs to be co-created with all of you. So even when we think about partners and collaborators, you will help us define that. But here are some of the things that we already know we need and want and welcome you to do. So things like the social media campaign that we're going to talk about in a minute. We need ideas for how to do that. We would love to have your support in facilitating that, getting the word out. So that's just one way. Sharing your ideas and experiences to shape the project in a variety of ways. I'm seeing questions and ideas come through the chat. That's one example of how that can happen. That can truly happen however makes most sense, depending on kind of what role you occupy as a person with lived experience, professional experience, et cetera. You've already heard a lot about sharing existing PRE and PRO items. We would love to have those if you have ideas, if you've got experience with these, if you just have an idea about what a potential item needs to be. And I think it's really important to stress that you don't have to have it fully formed. We have a whole work pathway dedicated to identifying, validating, creating these kinds of new questionnaire items or new measures or new tools. Even if you just have a notional sense, there's this thing I think that is going to be really important to capture. Share that, however, whatever language makes sense. Providing guidance on feasibility of proposed PROs and PREs. What might those barriers be? Again, thinking with the end in mind. If that's the space you occupy, speak up, let us know. Here's how you can make this pathway much more successful, maybe even smoother. That experience and insight is incredibly valuable. As we get kind of further into the project, helping plan, lead, participate in these virtual planning and prioritization meetings, wherever you see yourself fitting, whatever amount of time, resource you're able to commit, we would love to have you in whatever capacity that works. Really critically, and I think this is kind of no matter what hat you wear, no matter where you fit in our different buckets of partners and collaborators, serving as liaisons to your community. Not everyone can attend this webinar, for example. So all of you can take what you're learning and hearing and seeing back to your communities of practice, to your communities of lived experience, and share and continue to grow this mission and this work. Contributing to the creation and dissemination and analysis of the surveys that Sue mentioned, of focus groups. Again, however you see yourself fit into this work, we welcome you to the table. And then hugely, and this also speaks to, there really is no end of this project. Dissemination, dissemination, dissemination. Getting the word out, fighting for uptake and implementation. This whole community will be an important vehicle for doing that work. And so these are just a couple of the ways that partners and collaborators could be involved. And if you have additional ideas, we want to hear that from you. But it's really about helping us build us. And these are just some of the ways we think that can happen. So I think I'm going to turn it over to Lee, if you're ready to talk about the social media campaign. If we go to the next slide. Great. Okay.
Great, Lee. PFPS US is really lucky to have Lee Frost on board. She's a social media strategist, and we've been speaking with Lee about, how do we start creating this online, our presence on certain platforms. We feel that it's really important to hear from patients, all patients, and we think that social media is going to be an important vehicle. It also enables people who may not be able to write or submit things via, written mechanisms. And so we've been brainstorming how do we best reach out to the patient community via social media. And we were brainstorming with Lee about, what do we ask them? It has to be in language that's understandable. It has to be simple. It has to evoke a response. So Lee has been helping us kind of think through this, and we invite all of you to help us think, how do we, what is that question? How do we reach the patient community at this point? Lee, sorry, I just kind of jumped in there, Lee.
Oh, no worries. That was a great introduction. So we are active on a lot of channels. We are finding that the older channels like Facebook and what is now known as X are not as effective as they used to be. However, LinkedIn is still doing very well for us, and we've established new channels on Instagram, Threads, Blue Sky, and Spoutable. And I'm also in touch with some closed patient communities like Patients Like Me and The Mighty to see how we can work with them to get the word out, to get their input. And over time, I've started picking up new partners who are following us on social media. So things are going well. So I'm happy to take any questions, recommendations. I've been working in social media for a long time. I'm now across multiple brands. So I'm seeing this across the board. There are a lot of migrations as these new channels come up. So we'll see a lot of activity in some areas and then it'll shift somewhere else. So it's taking a lot of persistence and patience, but slow and steady wins the race.
Great, thanks, Lee. And so I think what I would like to put out to you, and we can take some responses now, but like in reaching out to social media to certain communities, um, what would be that one question? Because we want to ask, what matters most to the patients, especially those who've had a misdiagnosis or harm from unsafe care or have experienced discrimination. What is the best way for us to reach out to those communities, and what would that question be? Is it a like, tell us your quick story? Is it what matters most to you about safety? Because we've got to, I mean, we understand the language, most of us are here, but we have to make sure that this is understandable from the patient's point of view. So if anybody would like to, boy, I don't know how to, I can't see when hands are raised, but, or if you want to put it in the chat.
Do you want to raise up one question that came
Yeah,
from Liz on TikTok? Because I love TikTok. I am on TikTok all the time independently. However, there are concerns because of governmental agencies sometimes do not want activity on TikTok. So
yeah,
an individual patient champion on TikTok calling for help on this would be
yeah,
okay, but us
yeah,
officially, it may be problematic with some of our partners. And I know that that's the case with IHI. We're
right.
not
Right.
a TikTok account.
And that's something that we need to learn from the patient community. And I think, if individuals choose to reach out that way, we can't control that. But and again, this isn't really official research. And actually, no one is funding this part of our project because we don't kick our project off till the funding really begins in September. So this is actually a PFPS US outreach. So that might help us, in using social media. So I'm seeing some might be good way to connect with through DM.
So I'm
Yeah,
seeing places of worship, the idea of sending a poll.
yeah.
Great.
We can definitely do polls on social media. That's easy.
Yeah, great.
And
Yeah,
Tony Land has just reminded us the importance of different generations, including Gen Z and millennials.
Right. Exactly. And I'm just going to throw out some ideas. I don't think Krista Hughes is on here, but she suggested that we even have people from different communities like do a short video and say, hey, I have, this has been my experience in healthcare. I experienced, let's say, a misdiagnosis. Have any of you out there experienced misdiagnosis, and what mattered most to you about that? I mean, something that's very personal, something that connects. And I don't know if that's even doable, Lee. That would take a lot of people to do like personal videos and post it, but or if we try to identify influencers um, amongst different communities to help out.
yeah, I'm working on like just individually trying to plant the seed to get, like even though it can't come from us officially, I'm trying to get the word out for other people to talk
Yeah,
about it on because healthcare stuff, especially patient safety and the troubles that people have experienced, are incredibly popular. I mean, I'm like chatting with people all day on TikTok about this
Yeah.
stuff.
Okay, lots of good ideas in the chat.
Yep,
Great.
Reddit's a good idea too. I totally agree there.
And just to give an example, most of you know that my son my son was harmed in healthcare when he was 5 days old, and it resulted in permanent brain damage. So my son Cal lives in this community of a huge community, online community of people with disabilities, and they have really remarkable conversations. And Cal posted actually what happened to him, I think it was 2 years ago, and I think he got 250,000 responses. And it was amazing that not only from patients, but from nurses and clinicians. And so this is why I think there's a really great opportunity on social media. I'm not that familiar with social media, to be honest. And so we're going to rely on a lot of you to help guide this. And again, this first step into the social media community is really like taking a pulse. Maybe after doing, a social media campaign until the maybe end of August, we'll see certain themes surface that will help us kind of in our prioritization process. So thank you all for your comments. Let's go to the next slide. So how can you get involved? On our webpage, there is a Project Pivot webpage on PFPS US website. You can see it right there. And there's a button that says join. So for some of you who are on that we haven't had any connection with, please let us know. Of course, you can spread the word to your families, communities, and then help build our questionnaire item repository. Again, it's on our Project Pivot webpage. It's at the bottom of the page. It's a form, and we might redo it to make it even more user-friendly. Armando and I have been working on this, but there is a place to submit existing questions, PRO and PRE questions. Many of them are validated, so that would be, and then we'll prioritize them. But at the very bottom, it says to suggest a question that doesn't yet exist in that we know of, that you would like to see on patient surveys about their care or their research. And I'm going to give you an example. What we're going to really hope that patients and others can really think about what has been their experience in safety, discrimination, bias, and misdiagnoses. And I'm going to give you, again, a personal experience, but in my husband's case, and most of you know that my husband died also of a misdiagnosis when his malignant pathology got lost. And so his cancer went untreated for 6 months, and it ended up killing him when he was 45. After thinking about his story, what I wish would have been on a patient questionnaire is, was I informed or was I given a list of pending test results? So I can see that as a potential question on a patient survey, such as HCAHPS, in that, like, a simple question: was I informed of pending test results? No, I wasn't. Had I known, the outcome may have been different. So try to think about what we're really encourage patients and family members and others to think about their story, and then kind of narrow it down to what could be the question on a patient survey, to capture what you wish you could have reported. So this is this invitation to help us build this repository of rich, innovative questions. Next slide, please. Oh, and so this is another way you can help us. Again, you can put it into the chat. We do have funding from our very generous funders, but like Suze was saying, that we really want to open up this tent to everybody who wants to be involved. So we are just launching a sponsorship campaign where we're reaching out to organizations and industry and others for scholarships to bring patients to our in-person meetings, because we feel that the heartbeat of Project Pivot is, again, the partnership that Suze talked about, but we really want to have a rich, diverse mix of patients and family members from all over the United States. And so we are reaching out to some partners, and thank you to Johns Hopkins. They are providing us incredible meeting space in Washington, D.C. for our launch on September 15th, and then our meeting on the 16th. APIC, the Association of Professionals in Infection Control, they are a partner of ours, and they are helping sponsor some of the costs for our meals. And ASEP, the American College of Emergency Physicians, they are also a partner, and they are also helping sponsor our kickoff dinner. So if any of you, I know a lot of us have contacts with groups that might be interested in either joining and or sponsoring. And I want to say that, our sponsors are also have provided some very innovative potential new survey questions that benefit patients. And so I just want all of you to think about this. We would like to invite as many people as possible and pay for as many people as possible, because we all deserve to be together and move this project forward. So thank you for your comments. I'm not actually able to look at them, but let's go to the next slide. And then I actually want to announce, and Marty, I think you're still on. If not, right after Project Pivot in Washington, D.C., Patients for Patient Safety US is launching a, I'm sorry. No, I have to back up a slide. So what's next? July 24th, we're having a webinar on what are patient-reported measures and how are they used in healthcare. And so that is for people who aren't really that familiar with it, or people who just want to join and contribute to the dialogue to really help all of us understand the importance of patient-reported measures and how it's filling an important gap. In August, we're going to launch the Appreciative Inquiry exercise. September 15th is the launch of Project Pivot. 5 to 6, a welcome reception on the 15th. And to 6 to 8, we're going to have a kickoff dinner. We're actually going to be doing an exercise at dinner, a very simple exercise, but we want to hear from everybody who attends the dinner. We want to start, again, filling in that funnel, and then we'll start prioritizing later on. And then on September 16th, we will have a all-day working meeting and then be flying out that night. Let's go to the next slide. And this is what I started to say, but right after Project Pivot is done, PFPS US is launching an Act Now for Safer Care activity. It's World Patient Safety Day, which is a WHO event globally. This year, it is on diagnostic safety. And just to see what's happening after Pivot, there's going to be Hill visits. There's going to be a premiere of a new documentary by Mike Eisenberg that we're jointly doing that with Academy Health. We're having a march to the Capitol and a ceremony remembering those who have passed because of unsafe care. And then we're going to have a closing educational conference at the Johns Hopkins University Blue Burn Center featuring some key leaders. I want to add that at our at the Pivot kickoff dinner, we have received confirmation that CDC, HRQ, CMS, National Quality Forum, and Leapfrog Group will all be sharing kind of some comments of why this project is important, and how they could potentially use what we're creating in their work. And so I think it'll be a really high energy meeting with a lot of really important stakeholders, including all of us, of course. Okay, so that is Project Pivot. That is, we're asking you for a lot of input. World Patient Safety Day happens after Project Pivot. Right now, for those of us in Project Pivot, we only have funding to bring us into DC on Sunday. We will have to leave on Pivot patients. Right now, we'll have to leave on Monday night. For those of you who choose to stay longer, we have a whole webpage on this. And we're actively trying to raise money so we can stay longer than one night. But that's where we are right now. So I guess we can open to questions. I'm sorry, I haven't looked at any of the questions. Marty, Armando, Suze, you might have been seeing some questions along the way.
Yep. There were some great questions and comments in the chat, Sue. So
Right.
one of them was just, do people even know what misdiagnosis is? So we do have to sort of, keep in mind that the
Right.
language we use and just even the concepts. I remember when people didn't know what patient safety was, and there's still a lot of people who don't. So
Right.
that, and then Tom Heyman, kind of quick
Marty, you're breaking
opportunity
up.
for. Oh, sorry, I can't. I don't think I can fix that.
Maybe
So
if you turn
I'll
off
leave that.
your screen, your video, you might have better reception.
Oh, does that help? Can you hear me now?
So far,
Okay. So Tom Heyman raised the prospect of earned media, and by having this in DC as we launch a year of focus on diagnostic safety, and frankly use our Hill visits. Part of what we're going to be doing the day after are Hill visits about the importance of patient safety, the importance of reporting patient safety events, including diagnostic safety events, which don't get reported well now. We'll have chances, I hope, to earn some media.
yeah.
It's also dovetailing with 25 years after To Err Is Human, so there's a little bit of an anniversary hook for earned media, Tom. So we're not advanced in our planning for that, but we're hoping that we can at least attract the DC media market.
And going back to the, that patients might not even know what a diagnostic error is. And I have to admit that, when I talked about Cal and Pat 20 years ago, that language didn't even exist around here. We thought of just a patient safety event. And so, Eric, you're online. I don't know if Seagal's online, but they were, they kind of brought this up, like maybe the patients could help us in their words over the course of the year. Maybe after that, working with patients in the space, we can better understand what it means to them. Maybe, Seagal, I see you there. Maybe at the beginning when we describe it, maybe we can describe it kind of in lay language that came from, maybe we can use the definition of the IOM that resonated with a lot of patients when we worked at CITM, because it was pretty, I think, basic, but this will be good to make sure that we help patients, first think about their story, and that their story might describe a diagnostic error. It might be something that we identify and they might not label it as a diagnostic error, but so I think that's a really good point, how we use language and help them understand along the way. And Seagal and Eric and others, as we may just capture what they're saying about their story and realize this is a diagnostic error. And I got informed, as time went on, that what happened to Cal and Pat were diagnostic errors, and I didn't even know it. So this is we might be able to bring this up on the July 24th webinar on capacity building. We might even talk about, some of how do we communicate right now, diagnostic patient safety and discrimination bias. Great points. And Tracy, I see you here. Hi, Tracy. And Tracy's here. Tracy's an expert, I would say, storyteller. And something that I want to share with all of you is that WHO will be launching. They said in June. Well, I don't think it's going to happen in June, but they're supposed to be launching a patient safety storytelling toolkit that was in part created by many, many patients. On how to tease out your personal patient safety story or diagnostic error story. And it really kind of comes down to thinking about your story and narrowing it down to like your what ifs. And what if this had happened? What if this had happened? So we want to use this kind of way to tease out your story and like, what are your what ifs? And how do we turn those what ifs into questionnaire items, survey questionnaire items? Like I gave the experience of my husband, my what if is, what if they had told me that they were pending test results? Turn that into a question. Was I informed, survey question. So we're going to try to use this kind of methodology of thinking about your story. And Tracy, you might be able to help us with this, and really narrowing it down to what are the key learning opportunities from that. And then how do we turn those into survey questions? So that's kind of what we're thinking of using, kind of that approach to helping us get to some of these new survey questions. Any other, I mean, I'm relying, Marty, Suze, Armando, if there are questions that I've missed.
They're
We have,
really all sort of
oh, go ahead.
answered. But Marty, it's just a whole conversation happening, so it's hard to pick out specific questions.
Well, there was a cluster of questions about how we're engaging, what we're doing to understand the impact of patient and patient-reported experiences. And impact is a deep word, is a big word that wasn't really defined. I mean, one thing that I know we'll be doing is looking at increasing the number of reports so we can get a better sense of this. But how are our research partners going to help us identify the research that's already been done in this space?
And I would love, in the thread, I think Michael Millinson offered to share some research and some articles. I think one of the challenges we've come across is that there's a lot of research on what validated tools are well thought of by researchers and clinicians and health systems, but we've had a hard time finding things that are really focused on what did patients or community members say were valid and appropriate and on point. And so I think that's where if you have those, we just
Yeah,
have.
it's real.
So,
I think what you're talking about, which is really important, is the difference between what looks good in the literature and what works in the real world.
Yeah,
And
Right.
and that is exactly the
Yeah.
kind of thing that I try to focus on. And what's interesting is that there's all these libraries of this stuff, and the question is what works, and then when you even think you know something that works, is you go back and go, well, is this really useful, et cetera, et cetera.
Right.
So I'll look through some of what I have, and a last comment. I did some an academic research a number of years ago on when ACOs were new, and we looked at how many were actually using patient-reported outcome measures in regular clinical practice, and it was so rare.
Yeah.
You look at the academic literature, you look this, and you look at how many doctors are using it and how many of them are using it, and it is really, really small. So that's what I'm really excited about this project is this is real world, and
Right.
that's wonderful. So we'll communicate. Just is that something, Suze, I should talk to you about? I don't want to overload Sue. Is there a particular contact person, or what would you guys suggest?
what do you think, Sue? I mean, I
Oh,
think
I'm happy to speak with
Yeah,
you,
but-
Michael.
All
Yeah,
right.
it's all of
So
us.
Sue and I,
Yeah,
Sue and I have known each other
yes,
for
yes.
years, so
Well,
I'm happy to go.
I would love that. And I think what we are creating together, the output of this particular project, we have to remember is we're identifying and prioritizing survey questions, PREs and PROs that matter to patients. So basically we're creating lists of things. So we're going to ask healthcare systems what matter to them, maybe emergency physicians what matter to them. We're gonna be developing lists, but the patients will prioritize this. But I think another outcome of this project, an output of this project, is I think we're developing a new framework on how to develop patient-reported outcomes and patient-reported experience measures. That's kind of a real world. We're backing up the methodology, and we're starting with us. And so it's somewhat of an experiment, but I think at the end we might have some, Sagas, you raised or nodding your head, we might end up with some new definitions. We might end up with a whole new framework of creating patient-reported measures. I think at the end of this project, we'll probably end up with more than we ever expected, to be quite frank.
But Sue, I think you're also, I presume, including the technology, right? Because what we're also interested in is now everybody's using it with all the dynamic framework and everything. And so we really want to make sure that as AI comes in and as a lot of other things come in, that the technology is not just patient friendly, but that the lists we do are appropriately used in the technology. And certainly, and then I'll
Great
shut
point.
up. One of my concerns is that what we think of as interactive is used by the healthcare community for people to be adherent
Right,
And
right.
and
Yeah, good
certain
point, Michael. Yeah,
certainly, yeah, adherence is nice, but we want an interactivity and a partnership. And I think underneath all the lists are, what do you do with the information? Do you use it to tell me what to do in a way to persuade me better with
right.
nudges, or do you use it to keep me as a partner? And that kind of subtext, you're going to use it to persuade me versus you're going to use it to partner with me, is something that I think is really important as a context to
Great
keep in.
points. Yep, great points. Let's have a
Yeah.
conversation. Yes. Hey, Leah.
Hey, this is really exciting. Couple things. One is, I hope that at the end of this, well, maybe not the end of this process, but as this process progresses, there's an opportunity to develop great measures that can be used to compare providers among each other so that they're reliable and it's, uniform and they're comparative. It's not just used within one particular provider system and never shared with anyone else, because then who cares? We want it public. So
Mhm.
I just always have to put that point out there. But the second thing is, what I would just one thought suggestion is reaching out to some of the platforms consumers use to try to find out information on their own. So like, when people go to, I don't know, Mayo Clinic, or they go to maybe Health Grades or Google to find out, I have these symptoms, or I have this concern, or, maybe we could get one of the tech companies to give us some AI intelligence about what kinds of questions consumers are already asking.
Yeah.
So that I get that would give us a huge database and potentially, by the way, additional.
Wow, that'd be amazing. Yeah, yeah. Let's follow up on that, Leah. Thank you.
So
Any
we've had
other
a couple of
questions?
suggestions in the chat box too about the importance of bringing in the Native American population, because they face so much bias, and a couple of good contacts shared as well. I know we
Terrific.
have one champion who's self-identified as a Native American, but we're light on that kind of a presence in amongst our champion group. I don't know if you've reached out as part of this group yet to anyone from that community.
I do know that we're gonna have a participant from Alaska, who specializes in, the Native American Alaskan, community. So that's not to say that's enough, but this is a good point. We need to build that out. Any other communities that you see that are that are missing, please put that in the chat box. This community has grown really quite organically. It's been lovely. But I think we really need to make sure that that all, important communities are represented. And I think we also, Susan and I were talking about this, although we do have some contacts, we don't have a strong participation yet from the Latino community. And I think we need to really focus on that. And we do have contacts in the Latino community. If any of you have, groups or organizations dedicated to, safety and health of Latino community, please let us know. Susan and I have a couple groups, and we're going to follow up on that.
So I also want to underline your request for help in raising sponsorships. I mean, events like this, we've done good work so far to kind of raise funding to bring people to an event like this. People who don't often get funded, they don't have employers who pay for this sort of thing. So, if you have organizations that you think would be interested in sponsoring this, please share those contacts with us, and we're hoping you'll stay over. Some of the people will be interested in the advocacy part of our activity, which is the march, and Hill visits the next day. So your sponsorship dollars will help cover that as well. So please help us do that. We're going to be really going to actually some of the organizations here that I see represented, but also your contacts, people you can lead us to that would do this. This is a rare opportunity for organizations, that might want to see this kind of work done to actually support it in a really, practical way.
Thanks, Marty. And I want to share that we also have, we've been, as you probably know, we've been writing grants to get liftoff for this project. And we've been successful so far, but we believe we need to bring more people under our tent. So we do have some grants that, you know, we were just denied recently a grant, but that's the world we live in. And we have a couple other in getting in consideration. So we will keep you informed of that as well. But, you know, we feel that some of our, and this is, to be honest, sponsorship is new territory for Patient Safety US. But we see it as an opportunity not only to get their sponsorship, but also to bring them into our project as they are already, you know, as for example, APIP, you know, they came into the project saying we're interested in sponsoring. Then they said, hey, I've got a question that I want to put in about infection control. And so they're already engaged. And so it's fun to see that happening. And it does, you know, it does actually show their I would say social citizenship, and that that their organizations are that they care, you know. And so again, like Marty said, any suggestions are, you know, welcome. Okay, we are 2 minutes to the top of the hour. I can't thank you all enough for everybody who joined and stayed on. And you know, this is a project that I think it's going to be a fun journey together. I think we're all going to learn from each other and make this project even stronger. So any last comments, Suze, Marty, Armando, from the team? Any last comments from those of you who've been listening?
My comments are, first of all, thank you everyone for taking the time to participate today. And secondly, please visit our Project Pivot webpage. And also there'll be, by end of business day today, there'll be a new posting there with these slides and the recording as well.
Oh, Armando, you know, Millicent pointed out, I think I had a slide with the wrong dates on it, the phases. So before we post it, I'd like to correct
We'll
that.
correct that.
Thank you, Michael, for pointing that out.
Great eye, Michael.
And
As
we have a portal live for people that want to submit questions, correct?
Yes. It's on the
Okay.
pivot page at the very
About
bottom.
that.
Yep.
And if we need
Okay.
to, you know, if you don't find it user-friendly, please let us know. Armando is a wizard on our website, and we can make it more user-friendly and or more understandable. I think we probably could. So any input on usability, understandability will be greatly appreciated.
Mm-hmm.
Great. Well,
That's great.
thank you so much all, and you will be hearing from us. And the next invitation you're going to see, I think some of you already have them, is our capacity building, or kind of our learning webinar at July 24th to learn more about PREMs and PROMs and maybe definitions of what is diagnoses, how do we use language appropriately.
Thank you.
Thank
Bye.
you.